Welcome to the deep dive. Today we're doing something really practical. We're going to get into liver blood tests.
That's right.
We've been looking at some great material from Blood Test UK, and our goal is simple. We want to give you a shortcut, a really easy way to understand what these tests are, why they're so important, and, how they're used, especially if you're in, say, Bedworth.
Exactly. It's all about catching any liver trouble early. It's just a huge win if you can do that.
Okay, so let's get right into it. A liver test. It's just a blood test, right? Simple draw.
Yeah, simple blood draw. But what it's looking for is, well, it's pretty clever.
What's that?
It's looking for these special workers in your blood. Things with names like ALT and AST.
Okay, workers. I like that analogy. So what do they do?
So think of it like this. These workers are supposed to stay inside the liver, doing their jobs. If we see a lot of them floating around in your blood...
It means there's been a breakout.
Exactly, a breakout. It's a sign the liver might have a boo-boo or some damage, from things like fatty liver disease or maybe hepatitis.
Right. And I saw that the source material from Blood Test UK mentioned some signs people should look out for.
Oh, definitely. Things like just feeling tired all the time for no real reason.
Tummy pain, maybe. Or even yellowish skin. That's jaundice.
Yes, all of those are big signals.
And that's really the biggest benefit here is finding out early, isn't it? Early detection.
It is. That's the whole point. It's your first line of defense.
So you can find a problem when it's still small.
When you can still fix it easily.
Yeah.
Maybe just by changing a few things in your life.
Changing things, like lifestyle. Our sources from Blood Test UK were pretty clear on that connection.
Yes, very clear.
They said things like drinking a bit too much alcohol or maybe not eating the best food. All of that can show up in the test results.
It really can.
Yeah.
So the test can be a sort of wake-up call. It helps you see if you need to maybe follow those NHS guidelines a bit more closely.
Eat more fruits and veggies, get some exercise.
Exactly, and bringing it local to a place like Bedworth.
Right, the localization aspect.
Well, the great thing is that the facilities there follow all the strict UK and NHS rules. So it's a safe, comfortable process. And the GPs in Bedworth, they're really good at explaining what the results mean.
So they don't just give you a number and send you on your way.
Not at all. They help you understand what it actually means for you and your health journey. They connect you to local resources.
So the whole process is pretty straightforward then.
Oh, very.
Sometimes you might have to fast. So not eat for a bit beforehand.
Correct.
Then they just take a little bit of blood from your arm and the results are back in a few days.
And the whole point is just keeping an eye on things, ongoing monitoring.
And if you think about the bigger picture, the test itself is, well, not a big deal, maybe a tiny bruise.
Right.
But for the NHS?
For the NHS, it's a huge cost saver. It stops little problems from turning into big expensive ones down the road.
And there's support available too, right, in places like Bedworth?
Absolutely. The NHS provides access to counseling, support groups, all the resources you might need are there locally.
And just a reminder for everyone listening, all this great, simple information comes straight from the guides provided by Blood Test UK.
It does. Which kind of leads to a final thought, doesn't it?
Go on.
Well, we've learned that a lot of people think, oh, a liver test.
Yeah.
That's only for heavy drinkers or people who are already really sick.
But that's just not true.
Not at all. We know that everyday lifestyle choices can affect those little liver workers we talked about. So the question for you to think about is, even if you feel perfectly fine, 100% healthy, how regularly are you actually checking in on your liver's health? Just to make sure that foundation is still strong for the future.